look at the disease burden in the United States right now, 80% of it is chronic disease. And if you look at chronic disease, 80% of that is directly related to lifestyle choices. When we go to medical school, we're not typically taught a lot about things like nutrition, about how to write an exercise prescription, about the importance of purpose and mindfulness as we interact with patients and how those affect disease. The lifestyle medicine competencies help us to learn how to prescribe exercise, to prescribe food. They help us to work with patients as we try to help them in their health behavior change, things that are very important as far as health are concerned.
Good afternoon, good morning, good evening, wherever you are in the world. I am Dr. Sal Lacanina. I'm the medical director for Lifestyle Medicine Institute and the CHIP program, and I want to welcome everyone to the program, welcome you to 2021. I pray that 2021 will be a better year than 2020. I'm sure that it will be, and thank you all for joining the program. I love this program because I get to speak to so many people literally from around the world that really know so much about lifestyle and behaviors and ways of taking care of our health in a better way. And we have a fabulous guest today, Dr. Wayne Dysinger, as you just saw on the intro screen. So let me give a little bit of introduction, but also remember that we have a chat button that you can put your questions in, and we'll hopefully have time at the end to get to some questions. Remember also that the programs are archived, so if you want to go back and look at this program or any other one in the future, you can do that on our website. So Dr. Wayne Dysinger is a lifestyle preventive and family medicine physician. He is the chair and co-founder and founder, of Lifestyle Medicine, which is a new model for primary care. And it's a concept that is really built around the principles of lifestyle medicine, which obviously we'll be talking about today. He's also the chair of both the American Board of Lifestyle Medicine and the International Board of Lifestyle Medicine. He's an active faculty member at Loma Linda University, where he does consultations, teaches and participates in research on lifestyle medicine, which is fabulous to get all that new information. He's actually the past president of the American College of Lifestyle Medicine and the past medical director of our CHIP program. So this is great to have Wayne on the program because he obviously knows CHIP inside and out. He's previously worked in various capacities with the American Medical Association, with the American College of Preventive Medicine, and with the Association for Prevention, Teaching, and Research. Prior to his current position, he was the chair of the Department of Medicine at Loma Linda University, on the faculty and co-founder of the Family and Preventive Medicine residencies at Dartmouth. He's also worked in faculty, patient care, and service capacities in Atlanta and Guam. He earned his MD degree from Loma Linda University School of Medicine in 1986, his MPH from Loma Linda University School of Public Health in 1990. He's a fellow of the American College of Lifestyle Medicine, the American College of Preventive Medicine, and the American Academy of Family Physicians. So my goodness, he's got so many accolades. I am so happy to have Dr. Dysinger on, and I would like to ask Wayne to please come onto the screen. Hello, Wayne.
Good afternoon. It's good to see you, Sal. Thanks for having me on, and greetings to everybody on the program. It's good to be here in this capacity for sure.
Yes, absolutely. You know, this is an interesting start of another year, and it's always interesting to talk to people about what they like to do with their health at the beginning of the year. And as you well know, so many people develop these ways of trying to have these resolutions for what they will do with their health. And it's really interesting to look at the fact that those resolutions really only last a short period of time. So maybe we could talk a little bit about the burden of chronic disease and what you see in the way that we treat and try to reverse and prevent disease in the current model, and then talk a little bit more about the lifestyle medicine model that obviously you know is much more effective.
Yeah, of course. And you know, I think probably everybody listening is quite familiar with the burden of chronic disease and how it's over 80% of our healthcare costs are dealing with chronic disease, and it's just overwhelming the system. But what I think is interesting is how this burden of chronic disease has really developed on our watch. So on your watch, Dr. Sal, on my watch, on in our lifetimes, it's really evolved. In fact, the chronic disease burden is going up and up. And if you look at, so I was born actually in 1961. And back then, chronic disease, this is specifically diabetes, but all chronic diseases were less, well, I don't know. Various chronic diseases have changed, but so let's just go with this one, diabetes, which is, I think, emblematic of some of the lifestyle-related diseases. But back in my lifetime, in 61, it was 1% of the population that had diabetes. And you can see how that's risen. And, there are some statistics that say now it's 12 to 14% of the U.S. population. Some countries, it's as many as 20% of the population. And if you look at prediabetes, so sort of people moving towards diabetes, it's as much as 50% of the population, even here in the U.S. So it's something that's really going poorly. And our medical system has brought to the table everything we can do to deal with this diabetes epidemic from a medical perspective. And these are the results we're getting. But on the other hand, if you look at smoking cessation, during some of the same time frames, we've seen smoking rates drop, and that hasn't been necessarily from the current medical system. It's been from the public health system and from other things that we brought to the table. So part of what the lifestyle medicine movement is saying is that we need to be bringing the same approaches that we're bringing to the table for smoking, which is around how do you change your lifestyle, how do you change your habits, how do you change these things that you do on a day-to-day basis. And again, starting off the new year, that's probably what all of us are thinking about. So we all have, I know for myself, I have habits that I'd like to adjust and to change. So that's what we're trying to do as a lifestyle medicine physician, as a lifestyle medicine practice, is really focus on helping people change these habits, not just figuring out how to adjust their medications.
Right. Yeah, this slide is really interesting to look at, because really the comparison between medications and the way you described using everything in the toolbox that we've had available for the past, how many decades, versus habit changes and the whole area of lifestyle versus genetics and such. And that's certainly one of the things I'm sure that you also hear this from your patients. Many people really believe that these diseases are more related to genetics than anything else. So how do you really educate your patients on the whole concept of genetics versus lifestyle?
Right. So, and it definitely does. Genetics definitely does matter. The patient I saw just prior to coming on the presentation here, she definitely has a genetic component to her high cholesterol. That's where we see the genetic piece play out. But what we know, and I'm sure you've talked about this, and it's clear in the lifestyle medicine literature, that the environment trumps genetics. So you can actually adjust your gene by exposing them to a better environment. And so I do talk about that with my patients, but I think there's nothing like actually having them experience. So what a classic thing that I'll do with my patients who show up with high cholesterol is I'll say, give yourself a month with no dairy. Or even just if no dairy seems hard, I'll just say with no cheese, because a lot of us, cheese is the highest source of saturated fat in the typical American, and saturated fat is the biggest driver of high cholesterol in the typical American. So if they just take cheese out of their diet, and most people, if you ask them to take cheese out of their diet for a month, most of them will say, "Oh yeah, I can do that." And then they'll see their cholesterol drop. And then they'll realize it's not just genetics. It's actually it does matter the foods that I'm putting in my diet. And my guess is if you look at the people that are listening to this presentation, probably most of you aren't doing much in the way of dairy, anyways. So then the question is, what are the lifestyle changes that you need to be making? And it'll be different for everyone. But just as an example, of the patient I just saw again just before coming on the program here, she was vegan. She was doing everything right from as far as staying away from animal products, but she was still having high cholesterol. So again, she had a genetic component.
Right.
And for her, we were trying to adjust up her fiber because a higher fiber level actually makes a difference as far as cholesterol is concerned. And then we were trying to adjust her overall fat load. So even when you're vegan, you're still getting some of it. And so adjusting exactly how that fat goes, because there's some data that some of your monounsaturated fats actually will help your cholesterol. So anyways, I'm getting in a little bit into the weeds here as far as what we do. But again, just trying to give examples of what it looks like when you sit down with a lifestyle medicine doctor compared to what it looks like when you sit down with a typical doctor who's adjusting medications rather than adjusting foods.
Right. And I think that really is a very important point. I mean, the typical lifestyle medicine consultation and the lifestyle medicine physician really gets into the weeds, because really for the first 18 years or so when I was practicing traditional internal medicine, you really don't have enough time with individuals to really get into the weeds and find out what they actually eat. And all of my patients must be the healthiest people in the world, because everybody tells me I eat a healthy diet, but then if you stop at that point and you say, well, tell me specifically, what do you eat for breakfast? What do you eat for lunch? What do you eat for dinner? What are your snacks? Then you really get into the weeds and find out what they're actually doing. And you can make those adjustments in their habits that are just so impactful. One of the patients that I had yesterday, I told her that I would really like to do a nutrition approach with her and then have her do her lipids again in a month. And she said, is that really going to be enough time to see a difference? And I said, if you do what we agreed upon, and she was really on board with this, I said, you will see a dramatic change. And you alluded to that. I mean, in a short period of time.
You can, and actually the we're sort of focusing on cholesterol here because my experience is cholesterol is one of the easiest things to adjust from a lifestyle perspective. But I have personal examples with my patients, but also the literature shows quite clearly you can use lifestyle to dramatically change cholesterol. I mean, drop it 20 to 30 points. The Portfolio Diet by David Jenkins in Toronto, dropping cholesterol 20 or 30%. In just 2 weeks, just by diet changes.
Right.
So this lifestyle medicine absolutely works, and I see it all the time with my patients, and the literature plays it out as well.
Yeah, but not every physician obviously has the luxury of working in a lifestyle medicine practice the way we do. So because we always have physicians on the line and other healthcare providers in addition to people that are in the CHIP program or facilitators, what recommendations would you make to the traditional physicians or healthcare providers that want to start to integrate lifestyle medicine into their practices?
Yeah, and just maybe a little bit about my story that sort of leads to the answer that I'm going to give to your question. And thank you for asking the question. It's a great question. So I started my career in academia. So I was teaching, as you alluded to, in Dartmouth and in Georgia and a variety of different places, most recently at Loma Linda University. And I was training my residents in lifestyle medicine. And at the same time, the American College of Lifestyle Medicine was developing, and people were coming in and saying, this is the kind of medicine that I want to practice. I'm so excited about learning about lifestyle medicine, and it's nice to see treating root causes and really getting the changes that we can see in lifestyle medicine. But then the question for both the residents who were graduating, as well as the physicians who were coming into the college, was how do I actually make a living doing this? Because as you said, Dr. Sal, it takes more time. Mm-hmm. you can't in a 15-minute visit really do the lifestyle interventions that you need to be doing.
Mm-hmm.
So then I was given a unique opportunity. This is actually 6 years ago, to help start a new type of practice, a type of practice that was a primary care practice, but it had a lifestyle medicine flavor to it. And we said from day one as we started that practice, if we do fee-for-service medicine, if we do the type of medicine that this country has gotten used to,
mm-hmm.
we're never gonna reach our goal. We're never going to
Right.
Achieve financial viability. So we set up in our practice. I know what you're doing yourself, Dr. Sal, is a system where people pay us on a monthly basis,
Right.
and they pay us to keep them healthy.
Right.
So then my job as a physician is to give them whatever resources they need to stay healthy. And it sort of motivates me differently. I'm not motivated by seeing them a certain number of times, because if I'm motivated by seeing them a certain number of times, I'm going to have short visits and frequent visits, and that's not necessarily what works well for the patient or for implementing lifestyle medicine. So we figured out ways of doing this in all populations. We do use insurance, so I think in your situation, Dr. Sal, people are paying you cash, right?
Mm-hmm.
But in our model, we've figured out a way to collect insurance, still get a little bit of a fee for patients, and now the goal is, I see people are asking, how do you find a lifestyle medicine doctor in
Right.
certain places? And I think we're going to have a chance to get to that. But
Yeah.
this idea of lifestyle medicine is growing rapidly. Lifestyle medicine doctors are showing up more and more. And so now you can actually search and try to find them in your community.
Mm-hmm. Yeah, well, why don't we jump into that? Because I think that's such an important point. I'm sure that most of the people on the line really understand the concept now of lifestyle medicine and how important it is to look at healthy habits. So this question comes up so often. So maybe let's just jump into that. How do you help individuals if they're not in your area and they're looking to find a lifestyle medicine doctor? How do they do that? What should they actually look for to find the right person for them? And I know that you've been intimately involved with this.
This is the website for the American College of Lifestyle Medicine. So it's lifestylemedicine.org. You can see up there on the top corner. So go to that website, and then along the top bar, there's various drop-down menus. You go to the membership drop-down menu, and then you go down to membership directory. Hit membership, go down to membership directory, hit that. And then when you hit that, what you'll see is this page here. And this page here shows a map. So this is a map of the world. This is actually a map of all the members of the American College of Lifestyle Medicine. The American College of Lifestyle Medicine has over 5,000 members now. And Dr. Sal and I can remember just a few years ago where we had like 500 members. So in the course of 5 to 10 years, it's grown dramatically.
Right.
So you go to this website. Well, obviously, so I see someone's asking for a lifestyle medicine doctor in Southern Indiana. Right. Obviously, you can't tell what's in Southern Indiana, but you can go to the little drill down button there, the plus button there, and you can drill down into your area. So I did this for Southern California. So I drilled down to Southern California. These are all the lifestyle medicine doctors in Southern California, and I believe the sort of key here, the way to understand this is every green little icon is someone who's a member of the American College of Lifestyle Medicine. Now, these are not all physicians. Some of them are dietitians or other health professionals, nurses, nurse practitioners, PAs, physical therapists. There's all kinds of healthcare professionals, but about 2/3 of them are doctors. So the American College of Lifestyle Medicine, close to 2/3 of them are doctors, probably a little over 2/3. So that's the green ones. The yellow ones are, I believe, people who are board certified in lifestyle medicine. So as Dr. Sal said in the introduction, I'm privileged to be the chair of the board certification in lifestyle medicine. This board certification started in October of 2017. So we're just a little more than 3 years into the certification process. Dr. Sal, I believe, was one of the first people to get board certified. And we now have over 3,000 people board certified in lifestyle medicine in just a little over 3 years, which is amazing growth. So the yellow, I think, are people who are board certified in lifestyle medicine. And the orange are people who are both. They're board certified in lifestyle medicine, as well as they're members of the American College of Lifestyle Medicine. So if you look on this particular map, there's on the right-hand side, there's two orange icons, one near the town of Redlands, one near the town of Riverside. Those are my practices. So we have myself and my partners, and we have two clinics in those two towns. So you can do this for Southern Indiana. You can do it for any part of the U.S. Drill down and find who's in your area. Now, there's some areas that are still going to be a little sparse, but you can almost certainly find someone within an hour or two of where you live that has something to do with lifestyle medicine, which again, to me is so exciting because as Dr. Sal can remember, this lifestyle medicine movement just a few years ago didn't have anything close to this.
No, absolutely. So if you're in an area where there is not an individual that you could go see within a reasonable time frame of driving, how effective is a telehealth visit, a Zoom session, if you will, for lifestyle medicine?
So that's a great question as well. And there are now lifestyle medicine consultations from physicians that you can get regularly online. I see someone's asking the question about South Africa. And I will say, so there is a lifestyle medicine presence in Africa. It's been primarily in Nigeria. I don't know of anybody in South Africa, but I do know that the continent of Africa has been the continent that has developed lifestyle medicine, I think, from a slower perspective, just as far as this formal approach to lifestyle medicine. And to be honest, part of that reason is because South Africa doesn't need it as much. Africa has less challenges with chronic disease than most other continents do. But I'm sure in South Africa, there's plenty of challenges for chronic disease. There is throughout Africa. So I'm sure that will be evolving in South Africa as well. But what I can say is if you email me, and I don't know if my email is going to be on this presentation, actually it's on one of those slides. If you email me, I can connect you to people who are connected to South Africa. I don't know anybody myself, but I can connect you to people that are connected.
What's your email address?
My email address is my first name, Wayne, and then a period. So Wayne.Dysinger, my second name, Wayne.Dysinger, at lifestylemedical.com. So that's my practice name is Lifestyle Medical, all one word, lifestylemedical.com.
Okay.
So I'm happy for anybody to email me with those kind of questions.
Yeah. So why do you think, because there's probably a number of people on the line that are scratching their heads now to understand why the issue of chronic disease in Africa in general is not as significant as it is in more developed countries. So how do you answer that question?
What do you attribute that to? Well, I think probably all of us can make good guesses, and one of the places I would start off in my assessment would be that there's not as much processed food in Africa.
Right.
People are eating from their gardens and eating those high fiber, whole food, sort of more plant-based foods, way more than we do in sort of a Western culture. And that actually makes a big difference. It makes a huge difference. So if there's less processed food, more fiber, you're in a better position.
Yeah, I don't remember exactly where the Tarahumara Indian tribe is, but I know that Dr. Esselstyn, I have to pronounce his name correctly, has spoken about that in previous presentations. And, you know, the issue of fiber, he makes a real significant point about how that lowers the incidence of cardiovascular disease and colon cancer and such. And certainly if we look at just what people eat in these other cultures and how active they are, looking at the blue zones, and we've talked about that a lot, you know, all the blue zones of the world where people actually do things so differently than we do in America. It has such an impact on chronic diseases. So thanks for that information, you know, and again, Wayne.Dysinger@lifestylemedical.com. That's the email address that you can write to him at if you're interested in getting more information. I'm just looking at the screen here to see if there's any more questions. What type of, how should people approach so not only selecting a lifestyle medicine doctor, but what should they do in preparation for seeing the physician or the nurse practitioner or someone else that's doing lifestyle medicine to make sure that they're having a very effective visit with that individual?
Yeah, well, I think from my perspective, one of the first things is to remember that lifestyle medicine involves multiple areas. It's not just about nutrition. Right. A lot of people will come in thinking nutrition, and nutrition is incredibly important. But for my practice, I spend as much time, you know, we talked about how processed food has changed us in some ways. You know, it's good because we have better shelf life. We don't need as much refrigeration, that kind of thing. Mm-hmm. But in so many ways, bad. The same with other things. I mean, just the fact that we can now have this webinar over a video format is wonderful. Mm-hmm. But it also is not helping with our ability to just be quiet and have you know, meditative times in our life. So. Right. I think as you go to your lifestyle medicine doctor, you want to cover the sleep and the stress part. You want to cover the exercise part. You want to cover the nutrition part. You want to sort of look at all of that. And then I think you also want to go to your lifestyle medicine doctor to try to help find community. You want to be plugged into this lifestyle medicine community. So right. I can see that Annette watched me give a presentation on Chef AJ. So mm-hmm. Annette is clearly part of the lifestyle medicine community because she's connected to all these people who are out there sort of creating this community. We need each other, and we need each other in these webinar type ways. I think we also need each other, and it's been hard with COVID, but we need each other in our living rooms and you know, on our outings, on our picnics, and that kind of thing. We need to be doing that with people that support and understand us, and asking your lifestyle medicine doctor to help connect you to the lifestyle medicine community, I think is an important thing to also be doing, because for me personally, as well as I think for most of my patients, the lifestyle medicine journey is ongoing, right? It's not over with once I stop doing a certain thing or start doing a certain thing. I have to take the next step and the next step and the next step, and there's always growth, there's always opportunity. And there's always a little bit of a battle between the culture that we're in. Mm-hmm. You know, not to downgrade the culture, because there's a lot of beautiful things about living in the 21st century, but there's a lot of challenges too. Mm-hmm. There's diabetogenic, obesogenic things that are put in our face all the time. So we need this new community that sort of keeps us in that healthier place. Which a lifestyle medicine doctor, I think, can also help you find.
Yeah, and I like, and thank you for bringing up Lori Marbus. You know, that she's doing tremendous work, and I know that she's really impacted so many states in the nation right now, which is great to really have that access. But the one thing that I caution a lot of my patients about is telehealth visits are great, but at times you need to be examined, and you have to at times have that face-to-face visit. So as much as we can do lifestyle medicine, and we'd like to do a lot of it via telehealth and FaceTime or whatever you're using, sometimes you need to come in and be examined. So just leaving the individuals on the line with that point that, you know, if you're having abdominal pain or you're having some symptoms where you really just need to be examined, you have to go in. You can't do that by telehealth. But it is certainly a great part of what we're practicing in the hopefully post-COVID era with telehealth right now.
Right.
And as you mentioned, the journey, this is like, running a marathon. You start with one step and you hope to get to the end. And being healthy is a journey. It's not a destination where I'm going to stop doing what I'm doing now at some point because I'm optimally healthy. That, you can always be more healthy, if you will. So I don't see any other questions on the line. So what would you like to leave the audience with as far as an action plan, something that they can actually do today to really bring themselves along with their own lifestyle, healthy habits, and improving their own health?
Yeah, well, I think my current life goal is to try to make that lifestyle medicine doctor available to everyone that's out there. So if your healthcare provider is not a lifestyle medicine doc, try to find one. If you can't find one, try to encourage your healthcare provider to explore lifestyle medicine. And most doctors get excited about lifestyle medicine when they read about it, because doctors are tired of pushing pills as well. Right. So try to get them excited about it and try to get them board certified in lifestyle medicine. It's a doable thing. It's not that hard for a doctor. And just keep pushing this movement forward, because it's what our world needs. It's what we need as individuals and what we need as a society and as a culture.
Yeah. The way you started out, we cannot tolerate the status quo any longer. Chronic diseases will continue to get worse. The amount of money that we're spending on healthcare is just exorbitant, and we're not getting the outcomes that we really should get. So I, like you, really believe that this is a significant part of the solution for the healthcare crises that we have today. And I really appreciate you, because I know you live and breathe this, and you're a fabulous role model for healthy living. And that's really what I encourage. I see so many people that work in the healthcare profession, but they really haven't internalized it themselves. So I always like to leave our audience with the message that really try to become a role model for healthy living, and associate with people like yourself and so many of the great people that we've had on the show so far. So I really appreciate you and everything that you do and your leadership. And we stand on your shoulders and the shoulders of so many people in moving this mission forward, if you will. So I'll leave you with the last word, and then we'll just want to remind the individuals on the line. Again, these programs are archived. For our next program, Dr. Michael Clapper is going to be on. And if you haven't heard Dr. Clapper, he's another fabulous individual to listen to. He's going to talk about health and hope in the midst of a lockdown. So don't miss next week's program. But Wayne, I'll leave you with the last word. And I want to thank you so much for being a fabulous guest on the show and for everything that you do for lifestyle medicine. So the last word is yours, sir.
Well, thank you. And I'll just put my plug in for Dr. Clapper. Dr. Clapper mentored me as I learned how to help my patients in fasting. So maybe that's something that can come up next week.
Yeah.
So just to close out, I just want to thank everyone who's listening. It's you who are really making the lifestyle medicine movement, and let's just keep marching together towards our goal of a healthier place, a place that doesn't have the chronic diseases that we're currently dealing with.
Amen. Well, thank you, Dr. Dysinger. Wonderful to see you, Wayne. Stay well and have a blessed start of the new year.
Thank you so much for the opportunity.